everyone. My name is Tiago Pascoal, and this is Pedro Bastos. We work both at Take the Wind, that is a company that is on IPN, next door, from ISEC. It's a pleasure to be here, to return home. I was a student here a few years ago, so I'm very glad to be on this side for a change. So, what is Body Interact? Body Interact is a serious game. It's a virtual medical simulator for clinical reasoning. The best way to compare it to other simulators is like a flight simulator, but only for doctors. On a flight simulator, the pilots test with different planes, different airports to make the safest procedures. So this is the same thing, but is for medical students and doctors. So first of all, before I start to introduce what is Body Interact, I would like to talk a little bit about serious games. What are serious games? So serious games are simulations of real world or processes designed for the purpose of solving a problem. The main purpose is to educate, not for fun, not for just playing, it's for education. So in situations where mistakes during live performance can be very costly, the best thing to do is to practice a lot, practice every aspect that the simulation has. So these serious games are already used in many types of industries, like military simulation, medical simulation, virtual reality, architectures, advertising, and retail. The one of the great advantage, it's risk-free. For example, if you have a patient, if you make a risk, the patient could die or could have severe injury. On the medical simulator, you don't have any risk. You can do whatever you want, that the patient doesn't suffer. So, what are the main features of the product? So, the main features, when we first talk about medical simulators, the first thing that comes to mind are the mannequins, the high-fidelity simulators like we used to see in simulation centers. The Body Interact is a little bit different. It's a virtual. So you don't need a mannequin, you just need a computer or a tablet or a browser, and the users have several clinical cases pre-configured where they have the patients evolving with several health conditions, and they have to make some decisions and try to understand what the patient has got according to their feedback. You can ask the patient questions, you can see visual signs if the patient is in pain, if the patient is sweating. You can see lots of visual signs in order to understand what is the diagnosis to conclude. So it's a cloud-based platform that combines dynamic simulation with problem-based learning and game design. This is very important. The game design component is very important because it's very easy to use comparing to other simulators. On a mannequin, you have a huge model on the bed and you have to perform lots of procedures. Here, you can be at your home, in your train, everywhere, and you can practice. You can practice the simulations without any problem. So you have a real-life patient giving you feedback, real-life feedback. You have a realistic physiologic algorithm. For instance, if you have your oxygen saturation lowering, you will have your CO2 increasing, so all the parameters are combined to provide the most realistic feedback. The health conditions of the patient will evolve through time. For example, if you have an hypertension and if you don't do anything to treat that hypertension, that will aggravate to severe hypertension and later, for example, for a cardiac arrest. You have immediate performance assessment. This is after you do the simulation, you will have a debriefing area where you can see everything that you did during the simulation and then what did you did good or did you did wrong for learning. The next time you did the same simulation, you won't make the same mistakes. That is very important for doctors, the debriefing. You have to practice to never commit the same mistakes. So let me just talk a little bit about the technology that we use to develop the Body Interact. We use a game engine, a commercial game engine that is Unity 3D with a C# language. All our developments are in C#, and we find that is the best language for our purpose. The Unity 3D brings us some advantages, like the fast production pipeline and the possibility to export for different platforms. For example, mobile, standalone, web, etc. We also use Blender. My colleague will talk a little bit more about this, for the 3D models and all the 3D pipeline. And we also use some MATLAB for mathematical calculations and algorithm simulations, like, for example, the oncology algorithm. That is a very complex algorithm. We have to use MATLAB to predict what will be the result when you are doing a two-year cases simulation. So it's very important to choose the right tools. The bot Interact has very many configurations. We have, for example, 2 simulation modes, the critical and the chronic. The critical simulation is a real-time simulation. Every second the patient will evolve according to the status and the inputs. And we also have a chronic simulation. A chronic simulation is like a turn-based game, for example. It's like when you go to the health center and your doctor asks you did you bring your exams, and he checks your exams and he asks another exams, and you come back 2 weeks, 1 month later, and then you have the follow-up appointments. So there are 2 different modes in simulations. In critical simulation, you also have another 2 modes, the pre-hospital and the emergency room. They are both similar. The aspect around and the configuration of the treatments that have available on each mode, it's the only difference, but the algorithm is the same. Like I said before, we have multiple platforms on our environment. We have the tabletop, that is a Windows standalone. We usually use a 46-inch table, multi-touch for every person to interact with him. We have a web version that runs on a browser, and we also have an iPad version that's already on the App Store. So this allows people to use in every way they want. They are not fixed to only one platform. That is very important. So in that in mind, the mobile version is a little bit complicated because we have the performance issue. An iPad has significantly less performance than a PC, laptop, or a standalone. So you have to have that in mind when producing assets, 3D assets, imagings, audios, etc. Every model must be optimized to the limit. We also have different medical specialties. For example, cardiology with cases for myocardial infarctions, cardiac arrests, respiratory for asthma cases, infectious, sepsis, neurologic cases like strokes, AVCs, in oncology with the chronic care. That are the most difficult cases, I can tell you that. Our real-like patient provides feedback. The feedback that he provides is usually in the form of audio, in the form of 3D signs, or maybe in the form of textures. For example, if your patient is low on oxygen saturation, he will suffer from cyanosis. That's where your fingers, your point fingers, will become purple or blue. That's an indication that you have low oxygen on your system. Sorry. Our target markets are usually universities and hospitals. We intend to reach the medical students at the early stage, providing them tools to get the best knowledge of the best clinical cases that usually don't appear on the emergency room. For example, a sepsis cases appears on the emergency room maybe 1 out of 1,000 cases. So it's very difficult to treat those cases. So you have to use virtual simulators to train that. We also try to reach the e-learning, the online learning training that people at home are making every day. People at home make certifications. They need to have some types of certifications in order to keep practicing. So it's very important to try to reach them with the least difficult for them. So online training is very good. Also, another target is industry. The pharmaceutical companies like this product very much because they see this product as a way to present their products to the community. So if a new pharmaceutical has a new drug, they would like to showcase to the industry. So they think these simulators are very good for that situations. Along the few years this product is in the market, we have established a network of business partners worldwide, so that the necessity of translating this product into several different languages was very high. So the product now is in multiple languages like English, Portuguese, Spanish, Japanese, Mandarin, French, and Italian. So the fact that this product is a virtual digital simulator makes it very easy to translate into different languages, comparing to other types of simulations, high fidelity simulations. The scientific partners that we gathered through the past few years, that include American College of Cardiology, American Heart and Stroke Association, and European Society of Cardiology, brought us some scientific validation that we needed in order to promote this product to a wider audience. So this product follows the medical guidelines, and these scientific partners review them and ensure that we are using those guidelines correctly. In the last few months, we have been awarded with two prizes that makes us very proud. It was the Best in Show EMSH at Serious Games and Virtual Environments Showcase in 2016, and also the European Seal of Excellence. So this is a proof that we are on the right way to achieve something. Now I'm going to talk a little bit of the use cases where this product is already used. So this product is already being displayed at the American Heart Association conferences, where they provide simulation zones for the medics to train and to improve their skills. Also, the George Brown College in Toronto is doing a very interesting study comparing the learning objectives with virtual simulators and with high fidelity simulators. The objective of this study is to try to demonstrate that they are not competitors. They can improve each other's things. So example, if you are on Bot Interact trying to solve a case, you can pause the simulation and when you will do a procedure on the mannequin and then you can resume your simulation again. So they are not competitors. They have space for both. Also, the University of Texas has a huge simulation center where they are teaching using Bot Interact as part of the curriculum, not only for nursing and medical students, but also for high school healthcare professions. So they are seeing the advantages of using this product in the curriculum of medical students. The University of UCAM in Spain already is using this also. This is the first university in Europe that is using this technology. And we are working now with the University of Coimbra to try to develop some cases with them in order to make the Bot Interact also part of the medical students of the University of Coimbra. So let me just show you what I've been talking to. I think it's better than just talking. So I will run some simulations and you can see what I'm talking. Let me just... I have two versions here, one of the emergency room and one of the chronic. I will show first the emergency room. That was the first mode that we did. Let me just adjust this. Can you hear? So this is the clinical case selection. You can see that we have several clinical cases. Each clinical case has a difficulty level, has a type, and you can see the information of the patient. For example, you can see, maybe I can try this one. You can see this is a woman, 82 years old, 64 kilos, and she was very busy with her daily activities, helping her family. So let's select this case and select.
82-year-old female on the Bigatron 110 for stroke prevention and atrial fibrillation, complaining of intense pelvic pain after a fall from stairs, which occurred 1 hour ago. Looks very pale.
So you can see the patient lying on the bed. Like I said, this is the emergency room scenario. She's at the hospital, and you can see there are bruises on the left side of the arm and shoulder because she fell on the stairs. So the first thing we do, you have to try to figure out what the patient has got. So you should turn on the monitoring, check the vital signs. So you can check the heart rate, you can check the oxygen saturation, you can check the ECG monitor, and you can check the blood pressure. So you can see right from the beginning that the blood pressure is very low. So maybe that's one of the things that you have to improve in the future. You have to give some treatments that affect their blood pressure in a positive way. So, but first of all, let's just interact with the patient, make some questions.
How are you feeling right now?
I'm in a lot of pain. My hip hurts.
The patient is in pain, so you have to do something for his pain also. Let's just talk to it a little bit
Tell
more.
us about any health conditions you might have.
My heart doesn't beat correctly. I have atrial fibrillation. Also, I have diabetes and kidney disease.
So this is a very complicated patient. She has got lots of diseases. So first of all, let's address the blood pressure. So if you access the treatments, you have the difference between medication and intervention. So in this case, let me just give him some drugs to increase the blood pressure. So I think, I'm not a doctor, but I'm going to do my best. I think I can give him some fluids. So you choose the fluids, you choose the administration mode, and then you choose the dose that you want to perform. So let me just administer 2,000 milliliters of fluids. The patient was complaining also with pain. She's in pain, so we have to do something. Let me just give him a little bit of morphine, just a little bit. Another thing you can do is you can ask for medical tests. For example, you want to see the ECG, or you want to check for example, an arterial blood gas, biochemistry, and a coagulation test.
Tests have been requested to the lab.
You can see the results here. The results are all normal because they are on the interval of reference. You can see that. Let me just give him some more drugs. I have to give him. So here you can see that are some results that are outside of the interval. So these are the results that you have to account in treating them. Here also, all these tables are dynamic. The simulator calculates these results every second. This is not static. This is according to all the patient parameters, all the health conditions, all the treatments that we provide to them, everything. So I don't know how to solve this case. I'm just showing you the main features of the product. I'm not a doctor. I try, but I'm not. So let me just give him some more treatments. For example, I can give him this.
Administrating first vial of dabigatran-specific reversal agent.
All these objects are interactive. You can interact with them.
Administrating second vial of dabigatran-specific reversal agent.
You can see the ECG of the patient in real time also. So let me just try a little bit more if I can solve this case. I really want to. So I think it's...
Requesting assistance of an interventional radiologist.
So I managed. This was easy. I just have to perform 3 actions. Well, this is very easy. So this is just to show you guys that you have to give a certain amount of prescriptions, a certain amount of medical tests in order to conclude the case correctly. This is very important to train procedure. For example, on a stroke, you have to do the same procedure every time. So this is very important to consolidate knowledge. So after the simulation, you will have the debriefing area. So the debriefing area is where you can check all your progress during the simulation. For example, the first thing that appears is a question, what do you think that was the diagnosis of the case that you just solved? So I think that this was a pelvic fracture. We will see if I'm right or wrong. So we have three types of reports. We have the action report, we have the full report, and we have the performance report. The action and the full are very similar. The only difference is that in the action, you only have the values of the monitoring that was on. So I turned on the respiratory rate and the value appears, and here the oxygen saturation. All the others are invisible. On the full report, you have everything that you did on simulation. For example, you can see that he started with these parameters, he had these health conditions that weren't treated, and you can see that with your actions, some of the health conditions were treated along the time. On the performance report, you can see what are the priority items that were made during the simulation. For example, I made 2 questions of first priority. I didn't make 4. So this is important to see what I did right or did wrong. So this is the emergency room. I would like to show you just a little bit about the chronic. That is our latest environment. It's still on developing stage, but I think it's very good to show you a little bit of more dynamic environment. So we will choose a woman again.
Female, 73 years old, hypertensive with gastroesophageal reflux disease and rhinosinusitis. She arrives today to have her first oncology.
So in here we can see the scenarios a little bit different. The patient is no longer on the bed. He is at a medical appointment or an health center. So here you have the same type of possibilities. You can interact with the patient. You can.
How have you been feeling lately?
I feel pain on the right side of my face, and I don't have the sensitivity that I used to have before. I also have lost the sense of smell and have difficulty in swallowing and in opening my mouth.
We can check the patient medical records. For example, you can see that she brought for the first visit the complete blood count, or for example, a coagulation test. These are very similar to the other in a different environment. We also can examine the patient. For example, we can watch the patient's skin looking for signs. For example, here you can watch the full patient, or you can go to the legs, or you can go to the head and you can rotate. And you can see that's a scar on his face. That's an indication that something happened. This patient performed a previous surgery, and that is very important for clinical solving cases. You can watch different angles, and then you can perform the same types of things on the ER. You can ask for tests, the imaging. I can ask an abdominal CT scan or a head CT scan, and you can see the prescription that the patient is already taken. He's already taken 4 prescriptions. You can prescribe new ones. For example, I'm going to prescribe the nivolumab for 2 weeks, and then we can advance to the next appointment. This is a different type of simulation. It's not a real time, it's a turn-based. The simulation only happens when we go to one appointment to the other. And here you can check for the medical test that you requested in the previous appointment. So here you can see that the patient has got this abdominal CT with this type of report. So this is a different approach to simulation, not only the real time, but the turn one based. I will let my colleague Pedro Bastos talk a little bit about the 3D pipeline, and then maybe you can have a Q&A if someone has got any question. Thank you.
That's what I do. I do the 3D for Body Interact. I'm responsible for that area. And the 3D in Body Interact is all done with Blender. So I have just a few slides prepared here for you, and then what I thought about doing is show you an example of a Blender file with a character, in this case, a patient. You have seen, Tiago has shown you one patient, but Body Interact has more patients, and the number is growing, and the quality is growing, and the scenarios, as Tiago said, are growing, and that is the purpose of having Blender in Body Interact. So before all of that, I'm just going to briefly talk to you a little bit about myself. So I am currently a 3D artist at Take the Wind. I have a PhD in digital media by Faculdade de Engenharia Universidade do Porto. I have 10 plus years experience in 3D pipelines. I've worked with other tools other than Blender, but moved to Blender about 8 years ago and been there ever since. Within these 10 years of experience, I've worked with character and environment productions. I've lectured in both professional institutions and academia in master's degrees. I have supervised master's students, and I have written papers and books. Okay, enough about me. What are the advantages and potential of actually having Blender at Take the Wind? It's a production-ready tool, I think. I feel very, very comfortable working with Blender because it really has quality. Sometimes there might be the tendency, a certain tendency for people to say that Blender, because it is open source, because it is free, that is the greatest quality about Blender. I think that the greatest quality about Blender is Blender's quality and the fact that it really is a fast pipeline. Also, it allows us to have an in-house tool that we can build upon if we need to, because it's open source, it's not commercial. So we can build upon that and build our own approaches and techniques using Blender. Then, of course, the community support. It's huge. You have a question, you have a doubt about Blender. I don't know how to fix this, I have an idea. I can go online, and I've discovered that I very easily can get a number of responses on any questions that I might have. And even if that question doesn't have an immediate answer available online, the community works towards getting that reply and reaching for a solution for you. So we all kind of work together, and that's also what we are doing here today as a community, as a Blender community. Online tutorials, you can find them in YouTube, in Vimeo, other sites, just as easy as click and go. And then, of course, it is free to use, so it represents no costs, and the company or myself or any colleague of mine that works with Blender can support the institution, Blender Foundation, Blender Institute, who make movies that have been presented by Francesco Sidi here today in the morning. So talking more relatively about the quality and fast pipeline, I don't know if you are very familiar about the pipelines. It has been discussed earlier today. A pipeline, a 3D pipeline, is usually linear, okay? Or at least that's the objective of a 3D pipeline. The fact is that that's not always the case. In fact, almost never is the case, because a 3D pipeline needs to go back and forth a bunch of times between all these 3D production stages. And what I find about Blender is that I can more easily jump between all these stages using Blender. For instance, one of the fields that is here highlighted, rigging and skinning, is a very delicate field, as Inês Almeida was talking about. You have to be very careful about laying out all the bones in a character, because that's what rigging is all about. Rigging and skinning is building a skeleton for a character and thinking about how the character must deform, and that is a very delicate process, as I was saying, and that mostly sometimes you build a skeleton and then you cannot or you should not re-edit that skeleton, re-edit the modeling or the sculpting or the UVs or the textures, okay, that were all built before you can build your skeleton. But in Blender, you actually can. Okay, and if you are if you have, I don't want to say if you are an expert, but if you have a certain degree of experience with Blender, you can do that in a very flexible way. You can do that about rigging and skinning. You can do that about texture painting and all the production stages. So that's what makes me most of all really, really happy about using Blender, besides all of the other aspects that I've mentioned before. It also allows for game engine integration. Blender has its own game engine, its Blender game engine, but it also allows to export for other game engines. As Tiago was saying, in Take the Wind, we use Unity, and we completely support, Blender completely supports Unity so far. I've been working in the company actually now this month 1 year, and every challenge that has been coming up to Blender by Unity, okay, we need this model working this way, the character needs to deform this way, the textures need to be put here that way. Blender has always been responding actively and positively towards all those objectives. What I do in the company is representation and animation of medical assets. Everything that you've seen in the emergency room, in the chronic environment, the room, all that you see in 3D, that's my responsibility. So everything that are objects, scenarios, and characters. There are also individual objects that have been built, scenarios as been seen, and characters, and specifically lately I've been working a lot on the visual realism of the characters to make Body Interact more appealing. That's also something that I've been working on, gender, age, facial and body features of characters, as I am going to show you right now through the visualization overview of a Blender file. It's not the character that Tiago has shown. It is the male correspondent, and here it is. So what can I show you here? Just the basic steps about Blender. So this entire character was built in Blender with cloths and everything. It was completely remodeled. We actually had this character in the company before. Yeah, I'm putting the guy naked. This is the rig here. And we can right now deform that. This rig has been, it's not a very advanced rig, or I should say it's not a film-oriented rig. It is a rig more adequate for games. As Inês was saying, it's very different to develop a rig for, no, not good. Very, very different to develop a rig for games than it is for films. Better this way, huh? The guy is the guy is sitting, our patient is sitting, and this is actually the pose that you were seeing in the chronic room where the patient was sitting in the chair. That's a representation of that. With Blender, I can come here and I have prepared the rig in such a versatile and advanced way that I can completely reset that pose and work with it in an inverse kinematics way and pose the character. And just going to right now what you saw was that I accidentally selected the character and I wanted to select the rig. So Blender allows me to come in here and block the character from being selected. In this case, the body of the character, so the mesh, the number of the polygons that compose the character. I can also do that for the boxers, which is another object that's being seen. And now I can, with no accidents, select the rig and completely deform it the way I want to. Okay, so we generally have a master bone that we can move around. We have a wrist and hand control, elbows. We also have the shoulders, head, eyes, And all of this content is a real challenge to export for a game engine, because the difference between, as I was saying backwards, the difference between film and game is that a film is pre-rendered. It's an offline media, while a game is a real-time medium. So while Tiago was showing the application running, a number of frames were running per second. That's a whole different setup that we have to do, both in 3D and in the software. And as you can imagine, we have this constant back and forth to make things work. And the more elements that we have in a character, the more complicated things get. And then we also have this kind of difficulties that are coming up here, which is you can see kind of the belly of the patient going through the cloths. Now, how do we solve this? In a game-based environment, we cannot have a high poly character, because then again, it's running real time, a lot of frames per second. So how do we solve this approach here? In this case, we use an opacity map that hides certain regions of the body, of the patient's body. So that's how we solve that. But it's not all related with bones. We also have shape keys, or blend shapes, as they are commonly known in the industry. So I'm just going to put the guy naked again, just for a few seconds.
Leave the shoes.
Leave the shoes. And the boxer, this is not just to show you another kind of approach that we have on Body Interacts patients, which is we have to alternate between different types of conditions that the patients and physical characteristics that the patients need to have. In this case, this is a regular patient that you could see around, but in this case, I can very quickly just convert the patient to an obese person, which is then again a clinical condition that has to be assessed. So all these possibilities then are exported to the game engine, and that's how we have Body Interact running using Blender. And that's pretty much it on my end. If you have any questions.
Yeah, we are available for any questions that you guys might have.
There's one.
My question is about one thing you said about making you more fat or more skinny or something like that. Use that type of thing to the purpose of that more great. How I say this in English, but
You can, português, sim.
como é que você, ou seja, vocês usam isto para conseguirem ter o crossover naquela lista de simulação, não é? E uma simulação mais direta e uma simulação mais indireta.
Sim.
Pronto, na indireta, eu estou a ver que vocês, se calhar, usavam estes conceitos para poder dizer que ele está engordado com o tempo.
Sim. O que acontece é, nós assim escusamos ter N modelos diferentes, cada um com uma fisiologia diferente. Nós conseguimos logo mapear o parâmetro do peso e do BMI, ou do IMC, automaticamente à blend shape da obesidade. Logo aí conseguimos ter um mapeamento muito direto e uma customização muito mais direta e muito mais fácil. E isso acontece no cenário crónico, em que o paciente vai, passado 3 ou 4 meses, vai aparecer com um peso diferente e diz ao médico que o próprio está a engordar. É um dos objetivos, sim. Yeah. Sim, até agora tem funcionado bem. O grande problema não, uma das dificuldades que nós temos é como o paciente está vestido também, ou seja, quando temos uma blend shape para o corpo dele engordar, a própria roupa também tem de ter essa blend shape e tem de estar diretamente mapeada para conseguir a roupa acompanhar o paciente a engordar. Isso é uma das dificuldades que temos tido ainda, mas que temos conseguido resolver razoavelmente bem. Sim, exatamente. Ou seja, é um simulador real. A nível de dinheiro? O modelo das universidades é um modelo diferente, é um modelo mais de subscrição. As pessoas não pagam a aplicação inteira, simplesmente compram X licenças para alunos, em que os alunos podem ter acesso a um número de casos por ano e esses casos depois vão sendo atualizados ao longo do tempo. Eu não sei ao certo os valores, mas nunca será um preço tão exorbitante como comprar uma mesa multitouch e instalar a aplicação. O modelo das universidades e dos hospitais é um bocado diferente, porque é mais vocacionado para o learning e não tanto para o showcase. É um modelo diferente nesse aspecto. Sim, as farmacêuticas que atualmente trabalham connosco são algumas multinacionais, tipo Boehringer, AstraZeneca, Novartis, a maior parte delas que estão aí presentes no mercado português e algumas a nível de mercado internacional, porque as farmacêuticas elas estão divididas muito por país. Nós podemos trabalhar, por exemplo, com a Boehringer Portugal e não trabalhamos com a Boehringer Internacional. Elas estão muito divididas por blocos. Então, inicialmente, entramos em contato com as portuguesas e agora, pouco a pouco, estamos a conseguir chegar ao mercado mais internacional, que nos permite arranjar estes business partners que há bocado referi na apresentação. Isso tudo depende. Nós temos casos de Standard Library, que são os casos que nós utilizamos para nós e para as universidades, e temos casos específicos que só para determinados clientes. São casos exclusivos deles que eles utilizam para fazer uma demonstração de produto. Ou seja, eles têm um lançamento de um produto e querem mostrar aquilo à comunidade farmacêutica, à comunidade médica, então podem pedir-nos para nós desenvolvermos um caso de demonstrar aquele produto. Mas lá está, esses casos são exclusivos só para eles e não tanto para nós metermos, por exemplo, numa App Store ou divulgar às universidades. São casos diferentes. Não. Se não tenho mais nada, eu agradeço o convite da Associação Blender Portuguesa para vir aqui apresentar o Blender Interact e espero que tenham gostado. Obrigado.